During the last year, COVID-19 has greatly impacted healthcare professions across the globe. Speech-language pathology is one of those professions that has been greatly influenced. Speech-language pathology assesses and treats speech disorders, language disorders, swallowing disorders, and cognitive disorders. And while telehealth has not been commonly used in speech pathology, COVID has changed how speech pathologists implement treatment and how students become speech pathologists. As a student, I've learned a lot about the history of the field and how it has typically been seen as an in-person career. The American Speech Association was founded in 1925 according to their website. An article from UNC describes the history of the career as post-World War II soldiers came back with traumatic brain injuries that affected their speech, which was studied, and they found neurological implications of how speech and language is processed and formed within the brain. This is an example of a screening skill that we've been able to use and create based off of research that has been done in the field. And many scales like this have been created for multiple different treatment and assessment tools. Telehealth has not been used or commonly researched in this field because face-to-face has always been recommended. According to many of my professors, before COVID, they did not really recommend the use of telehealth. On the Speech and Hearing Association website, they deemed that speech pathologists are essential workers. In May of this year, they posted a list of guidelines for determining whether or not in-person or telehealth practices could be used due to the law on not being able to abandon patients in the field. According to two different research studies at different universities, including the University in Brazil and the University in Harvard, telehealth has been determined as an effective alternative to in-person treatment during times of COVID. Easy access to technology has greatly influenced the ability to be able to have online treatment options. This image represents a kindergarten through third grade example of a learning program to help with speech production difficulties. There are many different programs that have been created and come out due to COVID, as well as within the past several years with the increase in technology. This has made it more convenient for people to have access to therapy, especially for people who live 20 to 30 minutes away from their nearest health provider. Another area that's been influenced is students being able to obtain degrees in speech pathology. Clinical hours is one thing that has been affected due to COVID. People were unable to finish their clinical hours in graduate programs because school switched over to online and clinic cannot be done online. So this is one thing that had to be changed during grad programs so that people could obtain their SLP degree. Schools have also started to get rid of their GRE score requirement on grad resumes because people have not had access to testing sites. One positive thing that COVID has created for the curriculum for students in speech pathology is adding telehealth to their grad curriculums, so telehealth can be more greatly accessible and be able many speech pathologists are going to be able to practice telehealth due to their expertise. In conclusion, COVID-19 has imposed many changes to the field of speech pathology, as well as the process of becoming a speech pathologist. COVID-19 has put a new reliance on using technology as a tool for therapy in the field, and it will be interesting to see how technology continues to influence communication within the world of speech-language pathology.